Appendicitis. Anyone who gets the symptoms I'm about to mention, folks, should go to the ER. Don't just take a painkiller and stay at home. Abdominal pain that starts at the navel, it increases gradually and steadily and moves to the right side within 24 hours or a bit less or a bit more. The pain intensity reaches 10 out of 10 and even more. The patient might have a high fever, digestive symptoms like diarrhea, vomiting, nausea. Sometimes the patient's appetite is completely lost. The patient might also have the usual symptoms of any inflammation, which are fatigue and body aches. Right. We agreed they should go to the ER. So what do we suspect? And what's the most important thing we want to talk about? Appendicitis. To rule out appendicitis, you must go to the ER. So how do we diagnose it then? In the patient, the doctor performs some clinical exams on the examination table to confirm if it's likely the appendix or not. If these exams indicate that it is the appendix, the doctor informs you and orders tests. What's the goal of the tests, if available? A higher probability it's the appendix, and to rule out other things. So sometimes, if a CT scan with contrast is available and the patient can safely have it, it's better, because many times the appendix doesn't show up on an ultrasound. Now here's another piece of information. Will it show up 100% on a CT scan? No. Most of the time it shows on a CT if it's inflamed, but sometimes it doesn't. Yes, so if it doesn't show, what do? We go back to relying on the doctor's decision, their clinical examination, plus the patient's symptoms. But there's also another part of the test, like urinalysis and a blood count. So what's the difference? Why am I doing a urinalysis? What's the goal? What's the goal of the urinalysis? The goal of the urinalysis is to rule out another cause like renal colic, or to see if there's an indication in the urinary system, like an acute urinary tract infection. The goal isn't to prove it's the appendix, the goal is to rule out other causes. The second thing is we do a blood count because there's a sharp rise in white blood cells. We also do a CRP test because it's one of the indicators of acute inflammation that can rise quickly. Alright, doctor, so we diagnose it through clinical examination, the patient's symptoms, plus some tests that help with the diagnosis and also to rule out other causes. So if we don't have a CT scan or the patient can't have one, we do an ultrasound. The ultrasound also looks for other things, not just the appendix. The appendix usually doesn't show on an ultrasound except very, very rarely. But it also looks for other things to rule out other causes. Alright, we've diagnosed appendicitis. What do we do for it then? Surgeons prefer laparoscopic surgery, and laparoscopy has more benefits than open surgery, which involves an abdominal incision. In open surgery, the incision is larger, so recovery is harder, and post-operative pain is more intense. Laparoscopy has small incisions, so recovery from it is faster, and post-operative pain is less. And there's an additional advantage to laparoscopy. It's a camera. It's like you're looking inside the patient's abdomen. It also looks at the surrounding areas of the appendix to see if there's any other inflammation. If there's another cause, he'll see it. Like a cystic ovary, for example, there's an issue, or the colon itself has another problem. So that's the benefit of laparoscopic surgery. Now, doctor, some people sent us questions about post-appendectomy pain. After the operation, well, let's first say that after the surgery, a patient might have some abdominal pain for 1 to 2 weeks, feeling bloating or swelling at the site of the surgical wound, which is rare with laparoscopy and more common with open surgery. It was also tight. The muscles are still healing since they were opened and cut, so they're healing. So the patient feels extra pain with certain movements. Now, if any of this happens and persists, you go back to your treating physician, and usually most doctors schedule a follow-up after the surgery to check the wound and ensure it's clean and free of any infections and that the healing is progressing well. Now, what about the appendicitis that occurs after the appendix is removed? Because this is something we received a question about, and it's something very, very, very rare, which is how can I have appendicitis after I've had it removed? Because a very small part of the appendix remains. This part might, as fate would have it, become inflamed, and when it does, it causes the same appendicitis symptoms we discussed earlier. And we go back to evaluating the patient in the same way. And usually, the solution is also to remove that part, because in the end, it's an infection. We can't leave it in the abdomen causing severe symptoms like these. Now here's a question that arises. Were all the appendix cases removed, whether by laparoscopy or surgery, actually inflamed? In a few cases, no, it's not inflamed, but medical procedures have rules. The goal of these rules is to protect the patient. Sometimes we rely on data like the patient's symptoms and the medical tests we ordered, and they aren't 100% certain. And the patient is suffering from very severe pain, so there are times when the medical decision requires opening the patient's abdomen or performing a laparoscopy. Even if the appendix doesn't turn out to be inflamed, doctors remove it. They can't just leave it, because in the end we'd be exposing the patient to another future risk of having that same spot opened again for any reason, appendicitis or otherwise, just to perform a procedure then. Therefore, a very small percentage of patients who have their abdomen opened or a laparoscopy done, and there's a suspicion of appendicitis, it doesn't turn out to be the appendix. because we have data we follow and medical rules governing this. And this is a percentage found in medical sources, studies, and the numbers say so. So this isn't the doctor's mistake, because many people look at this as the doctor not being skilled or misdiagnosing me, but never, ever. This happens beyond the doctor's control, because tests are just a guide for doctors. Symptoms sometimes overlap with symptoms of other infections, but medical procedures take their course with the main goal of protecting the patient. The strange thing is that some appendicitis patients don't have very acute symptoms. In the hospital, the doctor suspects appendicitis, but the symptoms aren't very severe. So the doctor says, okay, let's keep you under observation, and checks on him after an hour, 2 or 3. During this period, the patient takes medication based on the symptoms. Sometimes doctors prescribe antibiotics for it. They prescribe intravenous antibiotics for the patients. The patient, and this is glory be to God, sometimes the symptoms disappear or decrease significantly, and the patient who had no appetite now has an appetite. The pain that was 8 out of 10 becomes 2 out of 10. The patient who couldn't move and was screaming in pain becomes perfectly fine, wanting to go home and walk around. And medical tests find no other cause, find no other culprit. So we suspect it's appendicitis, but not very acute. And sometimes when these patients go home, doctors give them a course of antibiotics to take, a full course of antibiotics, and then they return for a follow-up with the doctor. Sometimes this issue becomes recurrent, and every time we evaluate, there's no other cause or culprit or another reason, so they're told it's subacute or chronic appendicitis. And this is a small percentage of patients, not the majority of patients. Therefore, the general rule we mentioned at the beginning, anyone who feels the symptoms should go to the ER to be evaluated. They shouldn't assume on their own it's the colon, digestive system, or IBS, and stay at home taking medications on their own. Go to the doctor to evaluate you, and he's the one to tell you if we suspect it or not, and he'll tell you the treatment procedure to follow. I hope the video was helpful to you. Anyone who has any questions or comments, write to us. We'll answer your questions, God willing, in another video. Those who haven't subscribed to the channel yet and find these videos useful, please subscribe. And for those who found the video helpful, please hit the like button. Happy holidays to you all, and see you soon.